Arterio Venous anastomosis, which are also named as vascular shunts. These are communications established between arterial and venous systems. And because of this arrangement, blood bypasses capillary bed. Because of their structure and function, these anastomoses are divided into three groups. Number one, preferential thoroughfare channels. Number two, simple arteriovenous anastomosis. And number three, complex arteriovenous anastomosis. Number one, preferential thoroughfare channel. It is a special type of direct communication between a terminal arteriole and a postcapillary venule. It provides an alternate route for the hours of less blood demand by the tissue. It is innervation independent and is located in the skin, muscles, heart, intestine, liver, spleen, and kidneys, etc. As regard its structure, it is a capillary with a few smooth muscle fibers in its wall. It gives a number of side branches as true capillaries. Each of these capillary have a precapillary sphincter which remains contracted during time of less demand by the tissue as shown in the diagram B, and only opens when the tissue demand increases as shown in the diagram A. Now, microcirculatory unit. It is a functional unit comprises of a thoroughfare channel with all its branches. Its size varies in tissues and roughly the capillary number varies from 25 in muscular tissue to only 2 in glandular tissue. It is a means of controlled blood supply to the tissue according to the demand of the tissue. And the best example is mesenteric circulation. Number two, simple arteriovenous anastomosis. It is a communication between a small muscular artery or an arteriole and a corresponding vein or a postcapillary venule. As regard its structure, it is actually a met arteriole which is in the shape of a straight vessel having a thick muscular coat in its wall and an average diameter of 20 micrometer. It is innervated by sympathetic nerves. It remains closed except during times of need. It is meant for providing increased demand of the tissue and is located in the skin of nose, lips, external ear, mucosa of nose and gut, and the erectile tissues. Number three, complex arteriovenous anastomosis, which is also named as glomus body or glomus apparatus. It is a highly organized arteriovenous anastomosis in the shape of tiny nodular foci which are present in the dermis of the skin. As regard the structure, it has got three components. First one is arterial segment which is present in the shape of a vessel having narrow lumen and a thick wall. This wall has got 3 to 6 modified smooth muscle cells which are named as glomus cells. This segment gives rise to a network or bunch of capillaries which is named as glomus body. This body opens into a venous segment, uh, which is present as a funnel-shaped thin-walled venule, which opens into a vein of the skin. Glomus body itself is enclosed in the capsule of connective tissue. It is richly innervated both by sensory and motor nerves. One thing to remember is that arterial segment is independent of both sensory and motor innervation. It contracts and relaxes in response to changes in the environmental temperature. This arrangement is located in dermis of the hand, digital pads, nail beds, and ear lobules. And this arteriovenous anastomosis type is highly differentiated in younger individuals. As regard its function, it is a shunt that has got regulating mechanism for blood flow and temperature, conservation of heat, tissue nutrition, and it indirectly controls the blood pressure of the individual. Arteriovenous fistula and hemodialysis. An arteriovenous fistula for hemodialysis is a surgically created shunt between an artery and a vein. The main purpose of this arrangement is to produce a dilated vein for easier access in patients requiring regular hemodialysis. There are three types of fistula created for hemodialysis. Number one, radiocephalic arteriovenous fistula, which is the most used fistula for hemodialysis. It is created between radial artery and cephalic vein at the wrist area. Number two is brachiocephalic arteriovenous fistula. This is created between brachial artery and cephalic vein by placing a synthetic bridge graft in the area of cubital fossa between the two vessels. Number three is brachiobasilic transposition arteriovenous fistula, which is created between brachial artery and transposed or translocated basilic vein in the area of the arm. Comments and suggestions will be welcomed. Thank you for listening and watching.